20 years, the American Heart Association's Go Red for Women initiative has raised awareness about women's greatest health threat, cardiovascular disease. Joining us this morning, Dr. Payvandi, cardiologist at Unity Point Health St. Luke's Heart Care Clinic, and Chase Grubbs, development director with the American Heart Association. Thank you both for being here.
Thank you for having us.
Well, Dr. Payvandi, let's start with the unique symptoms of a heart attack in women.
Sure. So, when we think of a heart attack, we usually think of the kind of crushing chest pain, feels like an elephant on the chest, but a lot of times we see women who are presenting with severe shortness of breath or upper abdominal pain, nausea, vomiting. Sometimes in women we'll see back pain, so in between the scapula. But I think we're fortunate in our community to have first responders and ER personnel that are well versed in these nuanced presentations.
Absolutely. What should someone do if they're experiencing these symptoms?
So typically you would call 911
yes.
and seek immediate medical attention, and that's always the right answer, is to call 911 when in doubt.
Okay.
If it turns out to be nothing, no problem, but at least we've captured some medical attention.
Absolutely. What about controllable risk factors for women?
Part of the American Heart campaign this year is something called Know Your Numbers, and so we're trying to empower women to know some key numbers: blood pressure, cholesterol, BMI, and their fasting sugar levels, because these all are kind of the core risk factors, not just for a heart attack, but for other forms of vascular disease as well.
Is there an age where women should be thinking about this more?
I think even starting in the teenage years, depending on family history, history of type 1 diabetes. I think it's a lifelong job to manage your numbers, to know your risk factors, and to be an advocate and an active participant in cardiac prevention.
And that's where you come in, Chase.
Yes, ma'am.
What is happening on November 6th?
So November 6th, we've got the Cedar Rapids Go Red for Women luncheon, and this is, for, like you said, over 20 years. And Unity Point Health has been an advocate. They've been a presenting sponsor of this event since its inception. So we're so grateful to have community partners. And like Dr. Payvandi said, our theme this year is Know Your Numbers. So coming in, and our goal is to everyone leave and be educated about their risk, because heart disease is the #1 killer of women. And so the event's going to feature a live auction, silent auction, and then obviously our program will run for an hour. Our survivor story this year is Marianne Osborne. She was actually coming to last year's luncheon and had felt some tightness in her chest. Said she immediately went to, this is something heart related, and so I think it's going to really resonate with those in attendance, as this is someone that was going to be in the audience with us last year.
Wow.
And she had a 95% blockage. So just getting to hear that story, I think, is going to really, like I said, sit well with our attendees. And we've got Liz Garcia as our MC, and dueling pianos will be playing kind of the pre-event. So
really?
that'll be
Oh, that's fun.
Yes, ma'am. People can buy their tickets and learn more at heart.org/Cedar Rapids Go Red.
And we're red.
Yes, we're red.
We all are today. Dr. Payvandi, is there
Yes.
anything else people should know about cardiovascular disease?
I think just being your own advocate and being sure, even if it's a touch point once a year with your primary care provider, that you're asking, what is my cardiovascular risk? Is there anything I can do to mitigate that? Should I see a cardiologist? Because we love seeing patients for what we call primary prevention before an event occurs.
Absolutely. Well, thank you both so much for joining us this morning. And yes, the Go Red for Women luncheon on November 6th at the DoubleTree in Cedar Rapids.
We hope to see everybody there, so thank you.
Yes, of course. All right.